Hello, my name is Dr. Noelle Lucas and I work at Blue Oasis Pet Hospital, and I'm here to talk to you about some of the questions that you may have about dog behavior. It's a pretty big category, and I have an assistant here to ask me a few questions. And what's the first question?
Dr. Lucas, if my dog is having behavioral problems, are they capable of changing?
So behavioral problems is a big concern for a lot of pet owners. It's actually the number one reason that dogs are put into shelters and given up from families are related to behavioral issues. The answer is yes. Often behavioral issues that you're finding to be unwanted can be solved. It's just what is the behavioral issue that you're having, and how chronic is it, and how much work are you and your family willing to put in to help solve that issue?
What are the most common behavioral problems in dogs, and how can they be addressed?
So the most common would be jumping up on people, so family members or children, maybe growling or biting out, or even biting people, scratching around door frames or scratching to get out of kennels, excessive vocalization, so barking at just people in the family, or as people are passing by or dogs are passing by when you're walking them, mounting behavior on each other, trying to just resource guard, so around their food or toys. There's quite a lot of behavioral concerns that clients bring to us, and there's more, but those are some of the more common ones.
Can behavior issues in my dog ever indicate that they are sick?
Yes, so behavioral issues that may be outwardly seen as being a problem for you but actually indicate an illness for the pet would be, so anxiety can be excessive vocalization or whining, even excessive yawning behavior can relate to anxiety and stress. Maybe urinating in the house could be related to stone or urinary tract infection. Having diarrhea or having defecation in the house may indicate GI issues. Scooting can be a medical related problem, but it's a behavioral issue. Sometimes neurologic disease can be presented like circling or head pressing or staring off into space and not being recalled through your vocalizations. They might not hear you. We can also see like halitosis or bad breath might be related to a medical issue that you are just seeing as a behavioral problem. Maybe they're dropping food out of their mouth because they have a bad tooth.
Okay, we talked about that. So how can a veterinarian help address my dog's behavior problems?
So a veterinarian can help address behavior problems by, first of all, hearing what your behavioral issues are, and then determining if there's an underlying medical issue related to that. And if there's not, then we can work with you to determine some of the environmental things that you might be able to change, or even some therapeutics, either supplements or medications, and actually even some trainers that we can recommend for you. So if you have any questions about your dog's behavior or behavioral concerns that you're having, we do recommend that you reach out to your veterinarian, or if you're in the area, please call us and schedule an appointment at Blue Oasis Pet Hospital.